My name is Dr. Richard Fryer. I'm a plastic surgeon in Draper, Utah, and I specialize basically in cosmetic surgery of the breast and the abdomen, and that is what I do all day, every day. I knew from a very young age that I wanted to be a surgeon. Everything fascinated me about the human body, about kind of trying to fix things. And plastic surgery just kind of fit in with my personality. I've always been very, very detail-oriented. It's a way to be creative, use your knowledge, and it really helps people feel better about things. Anytime someone is having a surgery, especially if it's unplanned, etc., they really they need that little bit of extra care to know that, yeah, they're okay, that someone took the time to do it right. And that's why I really fell in love with plastic surgery. Since I've been in plastic surgery, I started out taking care of probably some of the most complex injuries and traumas that patients would come in with. Gunshot wounds to the face, car accidents with the entire face broken up. Then I've kind of shifted focus a little bit. Instead of focusing on things that basically no one else could do, I decided that I was going to focus on things that everyone does, but I was going to do it differently, and I was going to find a better way to do things. Give people better outcomes, decrease the number of complications that they get from their surgery, and even helping them to recover a lot faster. And so that's now been kind of the focus of my practice for the last several years, is doing very common procedures, but doing it in a different way that I think is better. In the last several years, my practice is focused more on breast augmentation and breast surgery, including breast lifts, breast reductions. The remaining surgeries that I focus on are surgeries of the abdomen, tummy tucks. Sometimes we'll combine those two into something we call mommy makeovers, where we address issues with the stomach area and with the breasts at the same time. You can go anywhere to have these procedures done, but I now have patients drive past dozens of other plastic surgeons to have me do those procedures, because I look at things differently. I think I assess my patients very differently. I give different guidelines and instructions to my patients about the surgery, so that they feel like they really understand the surgery as they go into it. For example, one of the things that I hear repeatedly when women come to me to fix a breast surgery that has been done somewhere else is they feel like they are too heavy, too wide, that it is just something that they never wanted to be that big. And I think that that really comes down to that I think surgeons assess their patients based on kind of, this is the way we've always done it. And what I've tried to do is I've tried to look at things differently. And from all of the revisions that I've had to do, not a single one of them had an implant that I thought was suitable for them. We had to drastically change the proportions of the implant. And so what that has made me do is look at my initial breast augmentation patients differently. How can I give them an outcome that is better with the one operation, rather than having to come back in time and time again? I also, one of the other things that I do differently now in my practice is I treat pain preemptively. And so I've spent almost a year researching different options, different ways that we can address this problem and really minimize the amount of pain medication that our patients need and require. If you can keep those nerves calm and you can treat the pain before it has even begun, I think there is a very substantial and noticeable difference in the way my patients recover. My patients now walk into clinic the day after surgery and they look like my patients used to look 7 and 10 days after surgery. Their recovery is catapulted forward significantly.